Good afternoon, Professor and classmate. The topic I'm going to talk about is diabetes, food ulcer, and their recurrence. Definition: diabetes can lead to the appearance of skin lesion and ulcer in 25% of patients. Food ulceration is the most frequent recognized complication. This is due to the involvement of diabetes disease in the vessels, nerves, and epithelial tissue. Application in nursing. Wash the foot with soap and water. Dry very healthy in skin and between the toes. Introduce a swab to check the depth and affected tissue. Fundamental initial debridement take culture of the exudate by aspiration or biopsy. For the appropriate and necessary system antibiotic treatment. Frequent course continuing the dripping of non-viable tissues. Don't use hydrocolloid dressing or signs or suspicion of local infection. Avoid support of the affected foot area. Treat pain if there is one. Avoid member edema. Frequent moisturize healthy skin.
Hello, I'm Dr. Torrance, a podiatry fellow at the University of Michigan. Two of the goals at Michigan Podiatry are to prevent diabetic foot ulcers and diabetic foot amputations. I'm going to discuss diabetic foot ulcers and what to do if you develop one. Remember, everything I share is only for your information. Before making any medical decisions, you should talk to a healthcare professional first. An ulcer or wound is a break in the skin, as seen here. The main reasons people with diabetes develop foot ulcers are loss of feeling in the foot, poor blood flow to the foot, increased pressure, or direct injury to the foot. Diabetic foot ulcers have a high risk of infection, especially if you've had one for a long period of time. The infection can spread from the wound to the bone. There are antibiotics that can treat bone infection. However, if the infection destroys too much bone, the bone will need to be removed or amputated to promote better healing and provide a better functioning foot. If you develop a diabetic foot ulcer, contact your podiatrist or healthcare provider right away so they can develop a treatment plan for you. Your treatment plan will include blood work, X-ray, or MRI. Your provider will also show you how to dress or cover your wound and how to offload your wound for better healing.
Pros and cons. Pros: reconcile and treat early foot problems, can prevent serious complications. Healthy feet are strong and agile. And cons: the control of glucose is an important procedure, but they don't carry unnecessary control. However, most of the amputation of feet and legs are performed in patients with diabetes mellitus.
Today we will talk about how to cure the diabetic foot naturally and in a short time. Hope you watch this video carefully until the end. To know everything in details, diabetic foot is a very common problem among diabetics. It arises due to the high elevation of blood glucose levels. When this happens, blood vessels and arteries in our body do not function properly, which makes it impossible for them to perform their vital functions. If you fall victim to this problem, do not hesitate to seek your doctor immediately. Folk medicine has a great treatment for diabetic foot. It will be this wonderful natural recipe that you will learn in this post. In diabetics, it is very common because, due to the sensitivity of your skin, many types of wounds are difficult to heal. People who have diabetes suffer from diabetic neuropathy, an evil that does not allow the correct functioning of arteries and blood vessels. For this reason, it is very common for a simple diabetic wound to become a wound that is difficult to heal. Often these wounds, unfortunately, result in amputations. In addition to diabetes, there are other factors that can make it difficult to heal a wound in people with diabetes. These factors can be, for example, hypertension or hypercholesterolemia, excess cholesterol in the blood. In patients with diabetes, it is very important to control any type of wound, since in the future they may have serious complications.
Issue apply in Ecuador. The prevalence of diabetic foot is between 8 and 30% of patients with diabetes mellitus. In addition, the risk of amputation for diabetes patients is up to 15 times greater than in non-diabetes patients, while the incidence of amputation in diabetic patients is between 2.56 for 1,000 patients per year. In the context, Casanova has commented that in Ecuador, the incidence of diabetic foot is relatively very high because the diagnoses aren't performed in a timely manner at the primary level.
And it works. That's the best part about it is, the custom total contact cast works. Our patients have healed beautifully. It's been a fun program to bring Diu Health. I'm Beth Altenberger. I'm a physical therapist and certified wound specialist here at IU Health. Physical therapists, the way we're trained in school is very much focused on walking. So when we treat our patients to try and offload a specific area of the foot, we have a unique perspective of understanding walking very well. When patients come to our clinic for the first time to be evaluated for a wound on their foot, we do a full evaluation of both the patient and the wound. So we look at how well the patient's moving, where their wound is located, what caused the wound, but also the blood going into the leg, their arterial flow.
I started in January of 2012 to heal the ulceration. For 3 months, I went to another hospital wound center and they did a different kind of casting on me, and it actually just made my wound worse. It tripled in size in 3 days with their contact cast. Then once I started here, things progressed really rapidly and healing started rather quickly.
What makes a custom total contact unique is two things. First, the hard part of the cast, the material that you're used to seeing, that hard part of the cast absorbs about 30% of your body weight. The inside of the cast, though, the custom parts do the rest of the work. They're put on to sort of dangle the wound in space so that the wound doesn't get pressure. They essentially make the rest of the body weight go through the healthy part of your foot. So between the hard part of the cast and then the custom padding inside and the foot plate, our goal is that your wound essentially gets no pressure on it, and that's what allows it to heal.
In conclusion, the goal of managing diabetes foot ulcer is to prevent amputation and maintain a good quality of life for the patient. In order to achieve this objective, it is essential to carry on an evaluation and adequate examination of the patient, to provide an excellent education to both the doctor and the patient, to make it exhaustive plate for the prevention of ulceration, and is recurrence. And finally, to make an early recognition for the treatment of diabetic foot complications.
In diabetes mellitus, your body has trouble moving glucose, which is a type of sugar, from your blood into your cells. This leads to high levels of glucose in your blood and not enough of it in your cells. And remember that your cells need glucose as a source of energy. So not letting the glucose enter means that the cells starve for energy despite having glucose right on their doorstep. In general, the body controls how much